Hello, this is Dr. Bhaumik, and those who are following my YouTube lecture series by now already know that who am I. However, in my next slide, I'll just give my brief introduction for new people, hopefully those who will join this channel. Today, I am going to talk to you about a subject which is really not an endocrine, but it was requested by few of my viewers after my posting of the last lecture, which was polycystic ovarian disease and hyperandrogenemia in adolescent. So few of my viewers requested that if I would talk about acne vulgaris, which is a rather common problem, and can compare these two presentations and differentiate these two, and what's the minimum workup that may be necessary. So with that background, let me introduce myself to the people who will be joining to my channel. And I am Dr. Vomik. I'm a professor, I'm ex-professor of pediatrics, chief of the Division of Pediatric Endocrinology, Children and Women Hospital, University of South Alabama College of Medicine. And I also spent 20 years of my military career in United States Air Force and spent most of my time in academic medical center and retired as a colonel. I was also did 4 years of pediatric practice, just plain pediatric practice. So therefore, I am pretty comfortable in talking many of the pediatric subject. These topics that I am going to talk to you, which actually will be very interesting to our pediatrician, adolescent medicine, family practice who does do the pediatric practice, as well as pediatric resident and medical student. So with that background, let me tell you that the epidemiology of acne vulgaris. Well, it's actually very common. It's affect about 70% of the adolescent, and it is more so in the Western society, especially with the fair skin color. However, the Eastern people or the with the different skin color is not immune either. So most of them start around 12 years of age, and mind you, that kind of corresponding with your puberty onset of puberty, and is continue up to about 24 years or so. However, statistically, by the time they are about 24, 25, many of them will have less of a problem with this condition. But if you just read the statistics, then they will say that boys are predominantly affected more than the girls. But I think what it is actually means is that since the boys have testosterone, male hormone, which is androgen, their their appearance of acne vulgaris is more severe. So the acne vulgaris in those cases are more severe than the girls because of the male hormone. However, about 3 to 5% will continue to have acne even in their 30s. So it's not completely gone. So some people always have problem, but as you get older and older, that seems to be that will help these people to ameliorate their signs. So what is acne vulgaris? What is the pathogenesis of acne vulgaris? Acne vulgaris is an acute cutaneous inflammation and involving the pilosebaceous unit, which in short we call PSU. And this is because of the plugging or blocking of the follicles. And that stimulates to the formation of what we call comedo, which is the primary lesion of beginning and the primary and the very beginning lesion of acne. So this is stimulated, the process is stimulated by circulating androgen. As I have said that androgen level is normal, but they are still involved in the pathogenesis. And how it is? Well, it increases the number of the receptor, androgen receptor in PSU area. So even androgen level is normal, but it is the androgen is the evil here also. So when this thing happens, when this condition is diagnosed, so one need to remember the androgen level does not have to be high, but still it is the one which is making the problem. So in pathogenesis, we can say that so stimulation of sebaceous gland by androgen, and as a result of that, there is a lipid-laden materials which we call sebum. Production increases, and these materials is one of the most important factor in follicular hyperkeratinization. So most important was the follicular hyperkeratinization because of the excessive sebum production, and again that is stimulated by the androgen, but also that helps or that is a precipitating factor of developing a microbes colonization, which we now call Cutibacterium acne. So there is inflammation with Cutibacterium acne. Now, there is another thing beside having more androgen receptor, but there is another thing happening is also the increased activity of 5-alpha reductase. What is 5-alpha reductase? This is an enzyme which convert testosterone to more potent dihydrotestosterone. Now, remember the testosterone is not as strong, but this is a kind of pro-hormone. And it's the dihydrotestosterone which is the more potent androgen. So, there are two mechanisms. So, increased receptor and also conversion of testosterone to potent dihydrotestosterone. Now, if you look at the classification or gradation, if you grade them, how do you grade the acne vulgaris? Obviously, the first one is going to be the milder form, primarily non-inflammatory, and comedones, black and white head. So this comedones formation is majority of the time is in the forehead. It could be anywhere in the face, but forehead is the first appearance. And I will have very nice slide of all the gradation that I'm talking about. And the number 2 will be the moderate. There will be mostly papules and few pastules. Grade 3 is mainly pustule and nodule. And grade 4 is the severe form, and there is a cyst formation as well as abscess formation, and the most disturbing is the scarring of the skin. So let's see if we can see some of them. As I said, that you can see this is grade 1, that you can see that this is commodian and it is in the forehead, and grade 2 will be your mostly papules, and this one possibly a pustule, mostly papules, and it's all over. This is the severe form. This is the grade 4. There is some skin scar formation here. This is a pustule and there are lots of papules. So this is a man and who has got lots of the acne, and this is very, very distressing. So this is the severe form, and all effort ought to be made so that they do not develop this kind of severity. So key point about investigation. As I have said before, when you confronted with especially the grade 3 and grade 4 level of acne vulgaris, it's always a good idea. Even you most likely will be right, but it's a good idea to check the androgen. So think androgen before Accutane. Androgen levels are easy to track, test. It's just a blood test. Simply you can do the testosterone level. Some people might like to do dihydrotestosterone, but dihydroepiandrosterone sulfate, which comes from adrenal gland mostly, and also for girls it is ovary also 50-50. So that will be adrenal as well as ovarian androgen. So the level, if the level is high, then you know the treatment procedure is going to be a bit different. And try to understand, try to classify the gradation and understand if you not treating them aggressively or not following them, the one which started with a milder form will be a severe form. I do not believe there are, this is one of the most, I would rather rephrase it such a way, it is one of the most distressing thing for teenager adolescent to have severe acne as well as the scarring. And this is, according to the adolescent medicine, this is one of the source of medical source of depression. So it is most important to follow them, treat them appropriately, and also making sure that their follow-up is good. And usually they will come because they do not like that kind of acne on their face, especially at that age. So treatment-wise, treatment depends upon the severity. So in mild cases, there are lots of products now available. The mild cases must start with benzoyl peroxidase, topical retinoid, and some other group of medicine that's available nowadays. But if there is any suggestion that it is forming a pustule, especially in early stage of pustule, one should use antibiotic like tetracycline group, like doxycycline, and it may not be a bad idea if they are grade 3 and 4 to refer them to skin specialist dermatologist. And all effort should be made to prevent the scarring and prevent the psychological upheaval. So all I want to say here is that actively manage it early. Management and prevention will prevent the scar formation, which is very disturbing. However, there are a few things that I like to mention here also. If you are treating the patient just like the way it should be treated for acne vulgaris, and then suddenly you see that it's not getting better, no, or they are developing additional symptoms like hirsutism, male pattern hair distribution, and irregular menstruation, oliguria or amenorrhea, even your initial evaluation suggested that they had no hyperandrogenemia, please do check them, because I have seen few that they will absolutely will be okay. But so anytime you see the hirsutism, irregular menstruation, especially in the girls, do check those hormones, and this will be easy to diagnose, and also the treatment will be different if you do the same way that it has to be treated as I discussed in hyperandrogenemia. Again, pay attention to the psychological aspect, anxiety, depression, etc. So I hope that those who have requested to give this talk, I have not disappointed you, and this is something that is not a very big name disease or condition, but it could, since the face matters. The scarring of the face is depressing and distressing, and with aggressive treatment and timely referral to the specialist will prevent this condition. Thank you. I like to welcome anybody who will be joining my channel, and if you like the topics, and if you have any suggestion of any even pediatric topics, I'll be very happy to do that. And if you subscribe to my channel, and clearly every time I'll talk, and I have already submitted more than 45 topics on pediatric endocrinology, case study, board review, and I'm also specialist in pediatric metabolism. So I have couple of lecture related to the metabolic diseases in newborn. Again, thank you. Like to see you in my future lecture.